Now, calcium antagonist, which are used in case of angina pectoris, drugs blocks influx of calcium ions to the heart and blood vessels to vasodilate and lowering the blood pressure, cardiac work, and oxygen demand. Verapamil and diltiazem acts on both the heart and blood vessels. Nifedipine and other calcium antagonists act mainly to dilate the arterial vessels, blood vessels. Calcium antagonists or calcium channel blockers are used prophylactically to prevent angina. Adverse effects include the excessive vasodilation, hypotension, cutaneous flashing, and headache. So these are the symptoms: angina pectoris and myocardial infarction. Location of pain, substantial across the chest. In case of myocardial, location of pain is same. Now, radiation of pain, neck, jaw, or arms. That is also same in case of myocardial infarction. Nature of pain. Nature of pain in case of angina pectoris is dull or heavy discomfort with a pressure of squeezing sensation. In case of myocardial infarction, the nature of pain is same but may be more intense. Now, the duration. In case of angina pectoris, the duration of pain is usually lasts for 3 to 8 minutes, rarely longer. But in case of myocardial infarctions, the pain is usually lasts longer than 30 minutes. Now, other symptoms are usually no symptoms in case no other symptoms in case of angina pectoris, but in case of myocardial infarctions, the other symptoms like perspiration, weakness, nausea, pale gray color. Now, precipitating factors like extremes in weather, exertion, stress, and stress meals are for angina pectoris, and myocardial infarctions. The precipitating factors often none. The factors giving relief in case of angina pectoris: stopping physical activity, reducing stress, using the nitroglycerin. But in case of myocardial infarctions, the factors which giving relief like nitroglycerins maybe give incomplete but or no relief. Now comes to hypolipidemic drugs or anti-hyperlipidemic drugs. These anti-hyperlipidemic drugs or hypolipidemic drugs are used in case of hyperlipidemia. Hyperlipidemia, it is a condition in which there are high levels of fat particles or lipids in the blood is present. Examples of lipid includes cholesterol, triglycerides. These substances can deposit in vessel walls and restrict the blood to flow. This creates a risk of heart attack and stroke. So this is actually called the atherosclerosis. In case of hyperlipidemia, the situation, the disease is called atherosclerosis, where the fats or lipids which deposit in the blood vessels. See, fat or lipids deposit in the blood vessels walls. This is the normal artery. This is the clogged artery. So the artery is clogged. Here spaces for flowing blood is too much narrower. This situation is called atherosclerosis. Atherosclerosis, I have just told you now that the buildup of fats, cholesterol, and other substances in and on the arteries or artery walls. Buildup of cholesterol plug in the walls of arteries. See? Plug. This is a plug which build up in the walls of arteries. So causing obstruction of blood to flow. Plugs may rupture, causing acute occlusion of artery by clot. So, what is the main cause of atherosclerosis? Atherosclerosis is narrowing of arteries caused by buildup of plaque. Arteries are the blood vessels that carry oxygens and nutrients from your heart to the rest of your body. As you get older, fats, cholesterol, and calcium can collect in your arteries and form of plaque. This is a normal picture of image of normal artery. So normal blood flow is to natural, and here plaque is building up. So high blood pressure, low blood flow, and here there is a situation of atherosclerosis where stroke or heart attack most common causes of death worldwide. This is also image of normal artery, and this is a atherosclerosis artery. Plaque narrows the artery, obstructs to blood to flow. So in this case of atherosclerosis, the drugs which are used that is called hypolipidemic drugs or anti-hyperlipidemic agents. Under this hypolipidemic drugs, the classifications are like statins, bile acid sequestrants, niacins, and fibrates. Statins, which mechanism of action is inhibit HMG-CoA reductase. Clinical use is lowering the low-density lipoproteins. Side effects is myopathy, hepatotoxicity, etc. Just remember this on the statins only. And others is just for your information. Then classifications of hypolipidemic drugs is first line therapy HMG-CoA reductase inhibitors like statins, atorvastatins, rivastatins, lovastatins, simvastatins. Then bile acid sequestrants. Examples you have to remember, but this mode of actions and clinical use and side effects are like all these things of this bile acid resins, niacins, fibrates. You don't have to remember. This is just for your information only. But remember the classifications of hypolipidemic drugs, like all the examples of each and every classes. Okay, the like HMG-CoA reductase inhibitors are like statins, that are lovastatins, bravastatins, atorvastatins, rivastatins, etc. Bile acid sequestrants like resins, cholestyramine, and inhibitors of intestinal absorption of cholesterol like stanol esters and CEPT inhibitors like torcetrapib. Here the mechanism of actions of HMG-CoA reductase inhibitor. HMG-CoA, which is an enzyme which turns the mevalonic acid, which transformation of cholesterol is occurred. So here HMG-CoA reductase inhibitors, which inhibits this HMG-CoA. Examples are like atorvastatin, bravastatins, rovastatins, rosuvastatins, lovastatins, etc. The statins are most effective and best tolerated agents for treating dyslipidemia. These drugs are competitive inhibitors of HMG-CoA reductase, which catalyzes an early rate-limiting step in cholesterol biosynthesis. So this is the mechanism of action. Fibrates reduce triglycerides, activate nuclear receptors. Then stimulates beta oxidation of fatty acids. Then increase low density lipoprotein synthesis, reduce production of FOC3, inhibits lipolysis and receptor mediated clearance. Very low density clearance is enhanced. HMG-CoA reductase, what is it's HMG-CoA to mevalonic acids. HMG-CoA reductase change this HMG-CoA into mevalonic acids, which is which increases the cholesterol synthesis and compensatory increases which increases the cholesterol synthesis, low density lipoprotein receptor expression in liver. But when statins is given, which inhibit competitively act with HMG-CoA reductase, which lowering the cholesterol synthesis. That's how it acts. Here is a therapy which is used in case of hypercholesterolemia, combined hyperlipidemia, and hypertriglyceridemia. It is just for your information only. You don't have to memorize it. Is a coronary artery thrombosis and its prevention is there.